So in this video, we're going to talk about treating plantar fasciitis and other foot ailments properly and how to help your patients avoid foot surgery. So this is a topic I'm extremely passionate about because it's very personal to me. Because before I became a physical therapist, my mom was dealing with some really bad plantar fasciitis to the point where she got plantar fasciitis surgery that actually made her problem worse. So before she got surgery, she first went to cookie cutter PT at a corporate clinic who didn't help at all. Then she got plantar fasciitis surgery that made her problem worse. Made it so bad to a point where she could only stand for 10 minutes in a row until she was in excruciating pain and had to sit down. And after I worked at Berman and learned a new technique on how to treat plantar fasciitis, we were able to solve her symptoms 100%, solve her root cause 100%, where this past summer she went hiking in Wyoming and was able to hike for hours with no pain. So in this video, I'm going to teach you a 3-step formula on how to treat plantar fasciitis and other foot ailments with close to 100% success rate. Step number 1 is get your patients off of orthotics. So orthotics are a complete scam because they make the root cause of your patient's problems worse because they cause the foot to get weaker. So let's go through a scenario of what happens when your patient buys orthotics. First, they spend a couple hundred, maybe even $1,000 on custom orthotics, and they feel better initially. But then a few months, or maybe even a few years afterwards, they start feeling worse and worse. And the reason is that the orthotic acts like a crutch for the foot. So it helps support the foot. However, it starts doing the job of what the foot intrinsics are supposed to do. So it causes the foot intrinsics to get weak and to atrophy. So what the orthotic is really doing is making the root cause worse. And after a while, you're just covering up symptoms until you can't cover up those symptoms. The root cause is worse and people end up eventually having to need surgery. So number one thing to not do as a root cause specialist is to prescribe your patients orthotics. Step number 2 is super simple, and that's just to release the plantar fascia. So release that tightness in the plantar fascia, put that great toe into extension, and just work through the fascial restrictions until the patient feels better. This is more important for people who have hypomobile feet compared to hypermobile feet. You can still do some plantar fascial release on people who are hypermobile, but I wouldn't prioritize it. However, with people who have really tight feet, whose feet don't move well to begin with, then this is a very valuable technique on how to help improve their symptoms and eventually address their root cause. And step number 3 is the most important one out of all of them. If you take away one concept from this video, it's this one right here, and that's to have your patients strengthen and neuromuscularly re-educate their foot intrinsics. So in Western society, most people's foot intrinsics are extremely weak and extremely deconditioned because we're overly reliant on shoes. So the best way to fix foot problems is to get those muscles stronger, get those muscles firing properly again. So re-educate those muscles in all different directions, whether it's flexion, extension, toe spreads, and have your patients consistently doing foot exercises as their HEP. This one concept right here helped me help over 50 patients in the last 2.5 years avoid foot surgery. And if you apply this concept, then I'm sure you will be able to help patients do the same thing. So the 3 components of successfully treating plantar fasciitis and other foot ailments are number 1, getting patients off of orthotics. Number 2 is releasing the plantar fascia. And number 3, most importantly, is getting the foot intrinsics stronger and neuromuscularly re-educating those foot intrinsic muscles. If you follow those 3 components, then you're going to have close to 100% success rate treating plantar fasciitis and other foot ailments. And if you want to learn how to become a root cause specialist and learn how to sell cash pay PT confidently, then fill out the coaching application below. And if you want to learn more about how to treat the root cause or what is the root cause, then click this video right here.